Hello, my name is Sky Sternino, and I am the lead author for the rapid review conducted on emerging literature on the impacts of the COVID-19 pandemic on health behaviors linked to cancer and chronic disease prevention. I have been working with a group of researchers within the Alberta Cancer Prevention Legacy Fund that conduct innovative research on the link to cancer and chronic disease as a student from the University of Waterloo Master of Public Health program. The objective of the rapid review was to use the emerging literature on the effects of the COVID-19 pandemic to create an educated perspective on how it is going to impact modifiable risk factors for cancer and chronic disease. To do this, we conducted 2 online literature searches combined with an additional external literature search to gather the studies produced between April 2020 and February 2021. The articles were screened for accurate timelines and empirical evidence while removing articles focused on screening or providing guidance to health practices during the pandemic. This resulted in a total of 35 articles included within the rapid review. We primarily focused on Canadian studies, however, we included studies produced by the OECD nations to further understand our research topic from a global equity perspective. The final remaining articles were critically appraised using the CASP tool. In order to increase consistency and reduce bias of the CASP results, 2 researchers selected 5 articles at random to conduct separate critical appraisals and compare results at the end. Data was extracted from the studies and organized by the following modifiable risk factors: alcohol use, mental health, healthy eating, physical activity, excess weight, and tobacco consumption. The categories for the risk factors follow the ACPLF framework based on population attributable risk when studying the factors most responsible for cancer and those that are preventable. These risk factors are important when considering most attributable cancer cases in Alberta, and we're continuing to seek the growing significance of mental health within the literature. The extracted data was analyzed with a health equity lens based on social determinants of health to complete a desktop HIA as defined by the Government of Ontario. From the rapid review and the HIA, we were able to find evidence of inequitable experiences for individuals for different age-related groups, disability, low income, or based on their sex or gender. Our rapid review of the emerging literature found mixed results and inequitable health impacts across attributable risk factors for cancer and chronic disease. Overall, the general trends are towards negative health behavioral impacts from the COVID-19 pandemic, but there is evidence of positive impacts within certain populations. Alcohol use was addressed by 11 of the 35 articles and found changes in alcohol consumption as influenced by age group and sex or gender. Participants within the young adult age range self-reported a decline in binge drinking, which may be due to the closure of bars and students coming home from post-secondary institutions. Overall, the consumption was reported as increasing. Alcohol was consumed more often when looked at days per week drinking, as well as reported increase in solitary drinking. Some studies found that alcohol was used as a coping mechanism for declining well-being, while other studies noted participants claimed to increase alcohol use due to tension within the home. Closely correlated with alcohol use was mental health. This risk factor included symptoms of anxiety, depression, and emotional well-being. 18 of the 35 articles discussed mental health, making it the second most common risk factor across the literature. Findings were able to see that social media could present positive benefits by connecting individuals to their peers and to supportive communities. The impact of electronics and social media fluctuated depending on user discretion, but if it was used to connect with helpful forums, the users reported positive impacts. Unfortunately, the home confinement and public health restrictions related to the COVID-19 pandemic had a majority negative effect on mental health. All ranges of severity of anxiety and depression increased, leading to a decline in overall well-being. The next risk factor was healthy eating, which focused on the quality of food consumed as well as the frequency and amount being consumed. Due to increased time spent at home, studies found participants reported less consumption of fast food, sugary drinks, and commercial pastries. The negative behaviors reported more snacking, more respondents claiming that they were eating out of control, and increased ultra-processed foods. Closely related is the risk factor of physical activity, which was the most commonly researched topic and was addressed in 21 of the 35 articles. Studies reported that during the COVID-19 pandemic, more children were meeting the recommended sleep guidelines, and more respondents are reporting time spent walking, as they had the time to exercise. The research also found significant decreases in overall physical activity levels, paired with substantial increases in time dedicated to screen time, sedentary behavior, and internet usage. The next risk factor was excess weight, which was only found in 2 of the included articles. A study found that despite almost half of the respondents reporting having access to weight management groups, there was still weight gain as a result of lost motivation to exercise and increased snacking. The final category was tobacco use, which was only noted in 2 articles. Tobacco use was found with mixed results, with both increases and decreases due to a combination of fear for the impact of COVID-19, as well as an increase in stress and poor mental health. The Health Equity Impact Assessment provided a framework for recognizing which groups were unequally experiencing the COVID-19 pandemic and its related impacts. Age was commonly reoccurring determinant, which was correlated with risk factors for alcohol use, mental health, physical activity, and different screen time coping mechanisms. Disability was seen specifically within the context of addictions and substance use. Research is lacking on how individuals with different types of disabilities were affected by the COVID-19 pandemic and present a current gap in the literature. Lastly, sex and gender was closely correlated with employment security, physical activity, alcohol consumption, mental health, and screen time behaviors. This rapid review concluded that the COVID-19 pandemic was found to have both positive and negative impacts on health behaviors associated with cancer and chronic disease prevention. We acknowledge that the study had several limitations, one of which was due to lacking an appropriate scoring system for the critical appraisal. The CASP tool does not include a checklist specific to cross-sectional study design, which was the vast majority of the articles. We developed a scoring system to quantify the results from the critical appraisals for a clearer evaluation. Another limitation was the limited research on vulnerable populations and how equity significantly impacted the reported effects of the COVID-19 pandemic. The rapid review provided insight into the experiences and effects of the COVID-19 pandemic throughout 2020. Across all of the modifiable risk factors, mental health was a consistent factor that contributed to the severity of outcomes reported within the emerging literature. The experiences from the COVID-19 pandemic thus far have not been experienced equally, and inequity is disproportionately affected individuals based on age, disability, income, and sex. The results of the rapid review were able to capture some of the effects of the pandemic thus far. However, as the pandemic continues, the influences on health behaviors may continue. Health professionals and community leadership need to be aware that these changes to health behaviors could persist post-COVID-19 pandemic and may have long-term effects. Our current public health programs and resources need to address the emerging changes in health behaviors while preparing for recovery following the COVID-19 pandemic. Future research should focus on research within a longitudinal study design evidenced by objective measurements. As the COVID-19 pandemic continues, further research is needed to study the changes in health behaviors throughout the waves of the pandemic. And once the COVID-19 pandemic reaches its end, research will be needed to assess the lasting effects from the pandemic during the recovery phase. Lastly, as each nation has chosen to approach managing the COVID-19 pandemic through various methods, research will be needed to assess how those differences have resulted within their population health.